Hi, my name is Dr. Josh with Marty, Chiropractic and Wellness. Today we are going to be covering soft tissue technique. Most of you know it by Graston. I am Graston technique trained and will be performing instrument-assisted soft tissue mobilization, or IASTM, with a myofascial releaser. The purpose of IASTM is to break apart scar tissue adhesions and decrease inflammation. What most of you will understand that by is improving your range of motion and decreasing the pain that you have with things like carpal tunnel, adhesive capsulitis, tennis elbow, plantar fasciitis, things like that nature. The purpose of it will be to use a little bit of emollient and use that emollient to have the tool run across the skin without having too much friction. The tool allows for feedback as to where the adhesions in the tissue are so that you can focus on those and break them up. So a traditional carpal tunnel treatment will involve the usage of the tool over the top of the palmar fascia or aponeurosis along that carpal tunnel area. Oftentimes the myofascial layers will become adhesed and there will be lack of motion through the wrist as you do your day-to-day activities, causing inflammation and entrapment of that nerve through the carpal tunnel. As we work through this, you're going to find that there will be some tender areas as we work through that fascia, but as it's broken up, it'll actually become a little bit of pain relief as well as kind of numbing sensation. This technique is very, very, very good at decreasing the inflammation and pain with multiple conditions that you probably wouldn't even think of. Everyday aches and pains can be involved with the inflammatory process surrounding adhesions in the myofascial structures, and IASTM is utilized to break up those tissues so that they can heal properly in the future. After your treatment, you're going to want to do some range of motion exercises and some slight strengthening exercises to make sure that the tissues reheal in the proper fashion. Otherwise, you could be looking at a chronic issue later on down the road, even with multiple treatments. Typically with an acute case, most often you'll only need about 2 to 3 treatments in order to get back to normal. Otherwise, if it's a chronic issue, you might be looking at about 4 to 5. Thank you for joining us today. That was just a little bit of IASTM demonstration using a myofascial releaser tool. Have a great day.